afternoon, everyone. Assalamu alaikum. Okay, we've been here for a while, so we want to first and foremost apologize for. We were planning to start at exactly at 11, but due to our need to actually wait for most of you to arrive, we are now just starting. So, thank you again for coming. My name is Farek Madot. I'm going to handle the responsibilities of the Master of Ceremonies for this event. As you all know, we are gathered here at Harmony Medical Center, which is a new medical facility owned and launched by Mr. Bonabol Bolarich, who is a South Sudanese businessman. And of course, we're all excited because this is a wonderful development in terms of one of the most pressing needs of this country, of ours, which is fairly new, of course, and has not had the experience of investment in the medical field or in the health sector during the history of our struggle for independence. So it is fitting that after 10 years, we are now having proper investments in our sector, especially from our private sector, in the health sector. So Bona is a pioneer in this sense. He's investing in a vital social good that will help all our people and will provide employment, but most importantly will address the need for quality medical care. So this pre-launch event is basically intended to invite the medical fraternity, especially. We have officials from the Ministry of Health, we have practitioners and specialists who are gathered here today, and we're very grateful that they have accepted the invitation to come here. And of course, many friends of Bol are gathered here. So I want to first and foremost welcome all of you and join you in congratulating Bol on this very important investment. So please, let's give a hand for everyone who has arrived. So I'll try to be brief and to the point so that we can get moving. The most important element of the event today is for you to get familiar, especially the medical practitioners, get familiar with the facility and the services that it has, and also to allow an opportunity for you also to interact with the managing director and the staff of the hospital, and to provide your very invaluable advice and support to them. That is the purpose of this event. So without further ado, I would like to introduce the developer and the owner of the facility, Mr. Bonabol Bol, to give some brief remarks in welcome to his guest. So please give him a big hand. Thank you, correct.
I think ما فاجر كثير أنا بتكلم فوقه لأنه عدد جينا للدرجة مع الناس يشوف في facility, especially the doctor, and the people more familiar with the equipment we brought it, and then to show and they can advise us before open official. So this one is adapt dinner a little. I think Batwana Vegetana can should equipment and the vision why we done this one. It's not born a Volvo already alone. I have a lot of my colleagues, special Dakato, Gan Gara Fukuba, background, Shakal for different Mazamat. And then we're going to be talking like a family. So, and we should correct. It's better we move, and then after that we can say more. But welcome, all my friends. Nasha Kalfi was our health. Ashanti the Sharuguna. I have a lot of friends here. More than Judge and AJ Shuf, what we doing. Example, Ambassador Philip Jada. Ambassador Mande in China, Jarajam Rwanda DC, Jaro Lakomno, then we call group, we become long, way from the struggle. So Uncle Elija is here. So this is gathered like a family friend. One of you just feel free, and we're gonna talk more, and then after that we'll go for lunch. And thank you for coming.
Thank you very much, Paul, and we have decided to inverse the program slightly to allow you the opportunity to get the tour. But before we proceed with that, I just want to recognize two names from officials from the Ministry of Health, Dr. John Romuno and Dr. Harriet Pasquale. Both of them are here, and we are very grateful for your presence. I would now like to bring to your attention that Dr. Madid Ton, who is the Managing Director and has been at the helm of the process of launching this hospital from the very beginning, is here. He's a colleague of Bona. He's a Cuban-trained doctor, and him and his staff will be leading you on a tour of the facility. So Paul and the officials from the ministry and the rest of the doctors, you are welcome, and to really see what has been done, and to give us later on, when we come back here, your observations and any points of advice. And then later on we'll have our lunch on and have an opportunity for speeches and before we wrap up. So thank you very much.
I will just be brief here, then we will go around. Actually, here later, these were apartments initially. They were not built as well. So we just transformed them into a hotel. This is going to be our reception and a waiting area. We are in the process of putting a counter here for the reception. So this is going to be the waiting area for the patient. And that room there is going to be the triage room. When you are registered, the patient will go there, check the vital signs, then they will wait until the doctor will call for the consultation. So the history is start here, then goes there, then they go to the doctor. Okay, we have 4 consultation rooms. We have 3 here, and then we have pediatric consultation room at the end next to the pediatric. So we just go this side, and then we come down. We have emergency room, then medical wards in the middle, and then ICU, VIP rooms, then we go to the next building. So we have 3 consultation rooms here. This is consultation 3, 2 there, and the first one there. That consultation room there we want to be for consultants, nutrition, any consultant that we want to be in there. Here, these 2 consultations will be for medical officers. We have also received some question medicine, oxytocin, some vaccines, insulin. We have enough insulin. We can even sell it. Even oxytocin is enough. This storage is not going to be enough for us, so we have another store in Tumpin where we are putting more supplies. All the consumables are in Tumpin. So this is just the third of the medicine we ordered that has come. So next week or the next 2 weeks. Here we have the hemodialysis machine. The accessories come. Also, the whole hospital is connected to local area network. The internet now is working, so we have all the machines that connected into the system. Doctor can access information everywhere in the hospital. So it's all the department connected to LAN.
So that has achieved one of the main objectives of this event, and now we come back so that we can have an opportunity to engage. Especially, we would like to hear feedback from our experts, the medical practitioners, about what they have observed and what feedback they have for the management of HMC, so that they could launch properly and be able to sustain the facility in the immediate term. So without further ado, I would like to introduce the Managing Director, Dr. Madid. He's going to give you an overview and a presentation on the facility and the vision, the history, the genesis of the program, and what the vision and the mission of the Harmony Medical Center is. So please, let's give him a big hand.
Ambassadors, it is from the Ministry of Health, all protocol observed. I will go briefly through the history of this facility. How has it come up, and how far are we from opening it? And as you can see, these buildings were built I think around 2012 by Mr. Bona Bolobol as apartment buildings. In 2019, Bona decided to convert them into a hospital. So by the end of 2019, he approached me to come and help him to convert the apartment building into a modern hospital. The building had 36 self-contained rooms, all furnished, but because of the fighting in 2016, most of the staff inside they were looted, including ACs and so many other things. So in January 2020, I came on board, came and assessed the facility, and we said, okay, let us see how can we convert this into a hospital. The two buildings were identical, and only they had staircases. Down, there were kitchen and sitting room. Down, all the rooms they were up. So we decided, with the help of engineer John Agar, to transform the rooms into wards. We demolished some walls. We created new walls, demolished windows and become doors. As you can see, we created corridors so that the patient can move easily. And that's why the left side, the building on the left side, has corridors and surgical cases. They are in that building, as well as maternity cases in this building. The right side building, we are using it for children that can be carried, people can walk. And we created the connection between the two buildings. That bridge there leads to ICU, as you could see. So we wanted to ease the movement of the patient. At the same time, we started also the procurement of medical equipment towards the end of 2020. And July last year, we received all the equipment that we procured from China. It's a Chinese company, but they were buying from different manufacturers. Actually, it took us 2 years to reach this level. A lot of money was put in to transform the two buildings. Towards the end of last year, we also started the procurement of medicines and some vaccines. 2 weeks ago, we received the first batch of medicines, as you could see in the pharmacy. We have to receive more drugs the next coming 2 weeks. Right now, we are in the process of recruitment. We are doing shortlisting. We advertised months ago in SFBC. We put it in also in Juba Monitor. Those who had the chance of reading Juba Monitor, we advertised. Actually, we are looking for permanent specialists for HMC. The main 4 specialties: surgery, surgical gynecology, pediatrics, and internal medicine, and a physician to take care of emergency cases and ICU. Other specialists can come, and this is where now we created this event to see if some of the specialists who have other clinics can join in and come here see patients in a scheduled manner. So we are still asking more South Sudanese specialists to come and collaborate with us, so that we have a full-time specialized service in the hospital. We went through the departments. We have the obstetrics and gynecology, general surgery ward with 2 orthopedic beds. We have pediatrics with 7 beds, internal medicine with 10 beds, ICU 4 beds, newborn care unit with 2 incubators. We are planning to bring 2 more. We have pharmacy. Actually, the store there is small. We have most of the consumable in Tumpe in other storage. You can see we brought oxygen generator because we saw during the coronavirus, our people were dying because of a lack of oxygen. So we decided to bring our own oxygen generator to generate the oxygen. Right now we can generate and sell to other facilities if needed. We have the ICU is fully equipped with 2 ventilators. We have all the monitors that you see. Ultrasound, X-ray. We have the lab almost fully equipped. We have dental unit, laundry room, incinerator. We did not see the other building. The end of this building, there was a swimming pool that we demolished and we brought up an administrative building. So we have a small shop there, a dining for doctors, a small kitchen where the food will be prepared and taken to the ward, because we are going to have inpatient feeding as well, which is going to be outsourced to other companies, as well as the cleaning services. We are not going to do the cleaning ourselves. Other company will take care of that. You could see we have the lift. So, again, we welcome all South Sudanese doctors who want to collaborate with us. We want to all together want to improve the quality of care for our people, so that people don't have to travel abroad for medical services. We have the skills, we have knowledge. I think the only thing that we need is the commitment from people who have money, like my brother Bonabol, who has done this. And as you can see, it's 100% South Sudanese. You don't have any foreign skill here or any foreign knowledge, only equipment that we brought and medicine that we are bringing from outside. So we can improve the quality of care, especially in the private sector, so that our people don't, they are not diagnosed all the time with typhoid and malaria. I always say, these are not twins. This is a bacteria and this is a parasite. What put them together? Why are they together all the time? It's because of diagnostic facilities that are inefficient. So I welcome all cadres, lab technologists, pharmacists, all the medical specialists to join us, to collaborate. We can send the patient here. The only thing we don't have MRI, we don't have a CT scan, but if we have other facilities, that how we can also send our patient to those places. So with this brief background, I thank you for coming and joining us today, and also want to ask you to also spread our information to those who have not come today. Thank you very much.
So we have an extra microphone here. Please raise your hand so that I can tell. And Madid will be here to answer, and if it requires a poll, he will join.
Comments? You don't have questions? You can comment. We have taken some of the observations that were raised.
All right, good afternoon, everyone. So just a disclaimer, I'm not a doctor or anything, but I'm here with my cousin, and I really enjoyed the tour, and I just want to say thank you to everyone who's involved with this amazing project. I'm really happy to see us starting to have things like this in South Sudan, so it's a huge accomplishment. So my question is, or I guess it's a comment. I noticed there wasn't a department or a unit for mental health or a psychiatric unit. It is a cause that is very dear and near to my heart as a counselor, and so I just think it's very important that we include this piece in any medical facility. So, yeah.
Thank you very much. It's a comment and also it's a question. Yeah, we want to expand. We want to expand, and obviously there are two things that we need in this facility. We need a counselor and we need a physiotherapist. Okay, these are part of the whole thing. We'll be receiving rape cases that need counseling, also HIV cases that we may need to test, but before testing we have to do the counseling. So these are the next level of cadres that we are going to bring on board. But obviously, I know mental health is a big problem. Even those who have been admitted, like with any infection, we can have also some crisis here that we may need a counselor as well. Yeah. So I think we have taken your advice and your suggestion. We'll be working together on that.
I'm Dr. Aja Paul. I'm an eye specialist. So it's a nice hospital, but I was walking around, I didn't see any eye unit, so I was hoping in the future you have an eye facility where you can help a lot of people. And I can see here many of you have glasses, and I'm wondering how come you are missing an eye department here? eyes, and next time I hope to see an eye doctor.
I don't want to talk about expanding, but I will give a chance to Bona because the other day he mentioned something that got me excited. That he wanted to purchase where he's going to build Doctor's Plaza, where all these specialties will be. So please, can you promise to people here so that we can have eye unit in the building?
Thank you, Dr. Rajak. We're missing a lot of departments. And I give you our program is to start. When we started, what we know we're missing, and then in performing, what we do is give us the chance to create more facility for people of South Sudan. Me, myself, I have a problem with eyes. When you're 40 up, you must wear glasses. If not, you are locked one. So we didn't forget. It's a matter of the time, and I'm sure we're going to have department of eyes. Like I was saying to Dr. Majid, they learn next to these two buildings, in the same side of the two buildings. And we want to allocate more, including MRI, in that building. And more departments are coming up. So it's a matter of time. We want to start first, the small thing, and we fund. I think it's nothing difficult now. The more difficult we done. So give us the time. Maximum going to be 2 months, and we can implement it all what they needed here. We have the people also.
Okay. Nevertheless, Dr. Raja, you're also welcome. If you have patients that you can see here, as I said, we have 2 consultation rooms for consultants. You can see your patients here, especially from this area of Jebel. We'll give you appointment dates. Actually, we are going to use a software that will help us to manage all these things, including appointments. So if you come on Wednesdays or Thursday, we give you that day for your patient. You can still do, maybe you may not do eye surgery, but if we bring instruments for eye surgery, why not? You can find how to deal with that. So you can start when we open until you have your own unit.
Second, I forget. My young lady who was talking about the mental health. This is a big issue in South Sudan. Like my background, military, we have almost our soldiers, they have mental health. And that one, it needs a place. It's not going to be small like this, it's a bigger one. We're planning, including with the headquarters of BIFA, to build really where we can see all these people. We have a lot of drama in South Sudan, in the war, and I think including somebody, is working normal, but it's sick in their head, like us. So it's nothing easy, but this one we're going to do it. We need a lot of people, at least do the program, the sick mom. Some people need more, and you see when the people they have issue of alcohol and all this is the mental health, and then is concerned too much in society of South Sudanese. So it need another facility, bigger than this one, especially like different room. I was in Uganda. I have one of my friends there. Problem, and we put a sick man. And when I went down there, really, it need a lot of job to be done. And then we're gonna coordinate with the Minister of Health and the SPLA headquarters is concerned about this issue. So I think it's concern of the people of South Sudan at all, actually the government. Some people become mental problem and then hurt their family, kill their wife, and all this violence. So it's one of the challenges we have in South Sudan. So give us the time we're going to do.
Thank you very much for giving me the floor. I'm Dr. John Kwali Rumuno. I'm a medical doctor. I specialize in public health and currently
I am Director General of Preventive Health Services in the Ministry of Health. My colleague Dr. Harriet will later on give official remark on behalf of the Ministry of Health. But I'm here first and foremost as a colleague to Dr. Daniel, and we met some years back, and in 2015 we had opportunity to go to Cuba. We were delegated by the then Minister of Health to represent the country in an international conference. And we had opportunity to look at the Cuban medical or health system, and we also visited health facilities and specialized hospitals. We were so much inspired, and since then, when we came back, we could meet occasionally to talk about how to improve health services and medical services in the country. And I want to congratulate Majid and colleagues who have put their hands together to realize establishment of this facility. I have 2 or 3 points. Point number 1 is this facility is a great contribution to our country, because as all of us know, many people, when they get sick, they seek medical services outside the country. And some people do that on their own, but majority of the people are doing it from public fund. And some time back, it was estimated that the country is spending almost 55,000 US dollars a day in medical treatment outside the country. So this is a very remarkable progress to ensure that South Sudanese get medical care within the country. Number 2, looking at it from the universal health coverage, this, in addition to accessibility, also it gives us availability. Looking at this area, it's very far from public facilities. This is bringing healthcare closer to people who are far away from town. Now, coming to observation, I have been in the public health area for a long time now. My colleagues who are still in the clinical service will give most of the comments, but looking at this area and also the facilities, we have seen the 4 or 5 consultation rooms. I want to believe that it looks like a highly specialized hospital, but you will end up having people from the vicinity coming for primary health care here. So you may want to think about how to take care of such cases. You talk about malaria, typhoid. You will have a lot of cases of malaria. Here you will have children, you will have women who may not be, having the purchasing power for this kind of hospital, but because it's the nearest hospital to them, they will come. So probably you may want to do something different, like as part of social corporate responsibility, to see how you can have those kind of precious wood.
To all of you. My name is Ambassador Mande Kumba. I am the head of our mission to the People's Republic of China. It is my great honor and privilege to be here today, together with my wife and my cousin, witnessing this important event. And I would like to take this opportunity first to extend sincere words of thanks and appreciation to my brother Bona, Bol, and the entire organizing committee for making it possible or for inviting me, my cousin and my wife to. Yes, it is my humble belief and assumption that many of you may agree with me that it's a dream of our able government and all of us that one day we want to see our people, our patients are treated here inside the country and not being referred outside. And I believe this effort that we witness today is a humble and recognized attempt to answer this kind of, question. And at this juncture, I would like to conclude, or after these few opening remarks, I would like to conclude by extending words of congratulations to Comrade Bona Rich and the entire management team of this beautiful medical facility for making it possible to put this facility in place. And then secondly, on behalf of my colleagues in Beijing, the diplomats and technical staff, I also wanted to reiterate and reassure you of our commitment to continue supporting your upcoming strategic plans whenever needed. With these few words, I wish you all the best.
Hi everyone. I think protocol is observed. I think everything has been said by my colleague who spoke earlier. My name is Monica Gumawe, pharmacist by profession, working in the Ministry of Health. What I want to add to this, Dr. Romono has said a lot. Thank you, Dr. And the speaker, Torejak, and others. Yes, it's a congratulatory message to my brother, Bona Boy. Bona, I don't think I'm the one who's going to talk about our background, how we came to this point. Dr. Okoni is there. I'll give him a chance. And Dr. Medit is also there. Dr. Medit has given overview of the hospital, how this hospital was founded. Yeah. But the background still there. We still have to talk about it. Bona, this is an achievement you have achieved, especially for Ranjit Karamwabio. I think that's what he wants to send us to Cuba. He always say that health is the first, and then the rest will come later. And you have achieved it today. Fidel Castro, I think, taught us that, and this is how we're supposed to move on the country. Education first, salute first, and you manage it. Salute first. There is no way you can feed an hungry children. And there is no way you can feed a sick child. So a child have to be fit, have to be healthy, and then the rest will come. And then the development will come later. So congratulations to you.
Thank you very much. Any more hands up? Anyone else? Okay, but if you want to wrap up. presentation. Any comments?
I think I'm done here. All the comments are well noted. All the suggestions been noted as well. And Roger Ramono, you know, I moved from public health to here, so I'm aware of that. And actually, putting this facility here will also reduce the cost of traveling outside. So this is something that also we already contributed by putting this here. People will come for vaccination, but we cannot do them here because these are government programs. If we are allowed to do it, we are very happy to do vaccination, especially the BCG and the BT3, we call it the Penta. If you are to us here, we can do them. But these are government programs. But nevertheless, we'll coordinate and collaborate on that. So public health is also close to my heart because I'm also a public health specialist. So your point is well taken, and Bona has noted it. We'll see how to deal with that, but not to turn away those who cannot afford to pay. It's something that we all have to discuss, including the government. Probably we may create health insurance or something that, you know, the poor people, they are the one actually paying more for the healthcare than the rich. Because they sell whatever they have, they sell their cows, they sell their produces, agriculture produces, for them to take care of themselves. So we need to think of them as well. So thank you. Thank you everyone for coming. You are all invited for the official opening, which is going to be probably the D-Day is April 2nd. So you are all already invited.
Thank you very much, Dr. Madid, for your presentation. I think it gave a proper illustration about what the hospital is envisioned to provide in South Sudan as a medical service facility. I think we are going to move forward to the closing remarks. Now that we have had a fairly extensive discussion, and many of the doctors had already taken advantage of the tour to share their views, so they did not have the interest to talk some more. But Bona has invited some of his friends who are here, and he would like to offer them the opportunity to say a few remarks. So we are going to ask them, and this is a way of acknowledging them also. We'll start with Ambassador Philip Jada, who is here from Washington, and I'm sure he will have a perspective on what we are here doing today. So please, you're welcome, Ambassador Philip Jada.
Good afternoon, everybody. Leadership of the Ministry of Health, my colleague Ambassador Mande and Ambassador Fick is sitting here. Friends, General Cook, the doctors here who are part of this facility, but also other doctors who are friends. I just want to start by saying, thank you very much for honoring the invitation by our friend and the leadership of this medical facility to come and witness this. And this shows the importance of what the facility is. This is not my first time to be here. I had an extensive tour, more than 2 hours. I think this was about 3 days ago with a friend who is also interested in investing in medical services in South Sudan, but he's from the States. So I was able to have a clue of what the facility is, and I must say that I've been greatly impressed, and I hope that we will keep this facility as it is and try to raise the standards of medical services that we have here. I am one of those people who believe that for us to have a solution to any problem, it has to come from within. I know that outside experience is important, but sometimes when people come from abroad, they really don't give you what you require because they don't understand the dynamics and stuff like that. So this is the day that all of you must be very proud of, starting with the pioneers, led by my brother and comrade colleague, Bona. And as my sister said before, this is what we are supposed to be doing for our country. And if we wait for people to come from outside to come and do it, I can promise you that we will keep on waiting forever. So the investment that has been done on you by the movement then to send you to Cuba, and you went through a lot, coming through maybe some of the Western countries like Canada and so on, I think we are starting to see fruits. And what better way is there to offer for us to see these fruits than to have a medical facility? I had the privilege of visiting Canada as in my capacity as the resident ambassador just before COVID hit. And I made a comment because I drove through oil fields, but you can't tell, you see an oil well in the middle of a farm. And that tells you that these two things can coexist. And at the end of my tour, my host asked me, if there is one thing that you would want to take away from here, what would it be? I told them the one thing that I want to would be the best practice. And I think if we start right, and we start with the best practice, we'll always get it right. So it is my hope and my dream that Harmony Medical Center will start and give the best practice such that other facilities, whether they will be private or government facilities, will come and see that this is the quality of healthcare that we want to provide for our people. That alone, if it comes and happens here in South Sudan, I think that would be a pride that you, Bona, the pioneer, and all these doctors, especially those who have studied in Cuba, will be very proud of. So I just want, at the end of my remarks, to urge you again, especially the doctors, and that let us support Bona in what he has started. Dr. Madid, you are leading a project that will one day make all of us very proud. Your success will be the success of us all, but also your failure will be the failure of us all. And they will say, they tried, but what have they done? So I hope that each and every one of us, given the same spirit that you have done today by attending this event, will continue to support this facility and make it to be the star which is in our flag that we will always follow to provide the better health facilities for everybody. Thank you very much.
For those remarks and for the pledge of support to Bona and the work that he's doing in the healthcare field. Now I would like to give an opportunity before we get to our final speaker, and I think maybe Bona wants to also make a quick presentation, but he will do that when he closes, about his future plans. We'll give an opportunity to General Akoknon to say a few remarks. Okay, so he said he's fine. Now we have with us the Director General for Medical Services, Dr. Harriet Pasquale, who has been with us here since the beginning. So please give her a big hand so that she could give her closing remarks.
Honorable ambassadors, generals, colleagues, doctors, the leadership of this great project, Harmony Medical Center, and all distinguished guests in the house. Indeed, it's my great honor and privilege to be part of this great occasion. I was really so excited when I visited the facility. The tour really gave me a very clear picture of how this hospital can have a great impact to our medical services in the country. South Sudan is still implementing a very fragile health system. So our health systems are still very, very weak to address all the needs of health in this country. Just to give you a bit of an update in regards to secondary level of medical care in this country, we only really have, let's say, like 3 main hospitals which are supposed to be providing secondary level medical care in the country. But even out of the 3, we have 2, that is Juba and Wow Teaching Hospital, which at least are providing some level of secondary medical care. Malakal Teaching Hospital is just picking up, but of course, it's not providing yet the health services to meet the health needs of the country. So we are really operating under a very, very challenging environment. And that's why, like what Dr. Romuno just mentioned, we are paying a lot. We are paying a lot of money for medical tourism. So most of our people go out for medical care just because we are not able to afford, or we don't even have the needed or quality level of care that can be provided in the country. So this is really a great milestone to the country. I have to say it's the first of its kind. I've visited most of the health facilities, the private, of course our public health facilities lack a lot of services. But looking at what is available in this hospital, it will really address most of the gaps that we have in the country. We don't even have a quality ICU, or actually I can say in this country we don't have an ICU, and that's why during the COVID, of course, we lost a big number of patients just because we're not able to provide quality ICU services. So patients, a lot of attempts were made to fly patients out of this country. But if we can have this hospital, even with the, I think it was 6 beds or 5 beds capacity, ICU, it can answer some of our questions, you know. Instead of spending a lot abroad, we now have something that can support our people in the country. So this is really a tremendous achievement. I have to say, for me, this year is really a blessed year for us in the medical fraternity. If we can start by seeing such great achievement happening. Of course, this hospital is also coming at a very important time where we are also planning to launch another tertiary level medical, or hospital in the country, which is in Gudele. So the Abu Dhabi Fund has also provided the government with funding, and they have constructed a 64-bed capacity in Gudele, which will also serve as a tertiary level facility. So it has everything, and it will actually complement what is missing in this facility. The Undersecretary and the Minister were supposed to be here. They sent their apologies, and they also convey their message of congratulations and really appreciation for having this great facility in place. They really apologize because they have a lot of commitment at this time. That's why they were not able to come. I just want to really give my message of congratulations to Mr. Bona, Dr. Daniel Madid, and the team for this great achievement. And one message I want to say is it's really important to have a beautiful facility like this, but we should always remember that a facility becomes more beautiful with the services it provides. So let quality be on top of everything we do. And I believe that we, the South Sudanese, we have the knowledge, we have the skills, but one thing we are really missing in this country is the tools that can really support us to deliver such quality services. With these few words, I really want to say once more, big congratulations to all of you, and I wish you all the best in running this facility. Thank you.
Thank you very much, Dr. Harriet, and all the previous speakers. We're coming to the end of our program. Unfortunately, we have been delayed with our caterer who's still coming, so we beg you that you please indulge us and honor us by staying a bit longer until the service is here. But while we wait for that, we also have the concluding remarks from Mr. Bona Bolbol, and I think he's going to elaborate also on his other plans. So let's give Bona a big hand as he wraps up.
Excellency Ambassador, Director of Ministry of the Health, my colleague, General Cook, ladies and gentlemen, welcome to MSC. Sorry, Ajama, for South Sudanese time. The program is supposed to start from 11. And look what time we are. Include the food is not ready. When we call them, no, they are in the way. But today is Saturday. Let us spend 11 hours so we can talk more. That's become a culture of South Sudan. Let me go back about the history. But I think more than of the history of this hospital, Dr. Daniel explained very well. So I'm not going to talk much about it. Hospital. I'll go back about the history. Where we come from. We come from Saga. Dr. Agum will talk about something to do with the Cuba. Where is the background we come from? Most of the doctors here, I think they have Cuban background. And first what I'll say, every night when you go to bed in the morning, especially me personally, I say thank people of South Sudan. Now the people of South Sudan give me a chance to love Sudan and work until Ethiopia, and Ethiopia until I get myself in Cuba, Canada, and different. Even though people of South Sudan, maybe I will still now, my village, take care of it now. But people of South Sudan, they start what they call the movement to liberate ourselves. And then that one, it cost us a lot, life, 2.1 million. People died to liberate us and to give us the chance people in their life today. So for me, it's a way to pay back to people of South Sudan. And these ideas to take the children to school in the wartime, late John Garang will sit with us every time and he say, you a fisher of this nation. We're going to liberate this country by bullet, but you're going to liberate it by development. So I think this is a good time to show our people we come from far, and the vision of the SPLA, we still have it, is to build the country. And to build the country, Agumi will talk about the child sleep with hunger, and somebody is sick. This one is no need Kalanjikum now. It needed development. And I think we young South Sudanese people, especially, they get a chance in the wartime to go to be educated, and it's coming back to come to the ball. So I think this is a duty of any citizen, South Sudanese. Let us fight issue of the development. I was sitting with the Minister of Finance, and he said amazing. just to refer people in South Sudan to Kenya, India, include now become a famous, if you have a problem with a teeth, you have to go to Minister of Finance to get 30,000 to go to India. And we talk about it's not money. Ever our leader or veteran, by age and by all the bullet they get in the bush, one will now get a chance to say, oh, Fulan is sick, we run to airport and they not reach to Nairobi. They died in the air. So this is our duty, to liberate ourselves with this situation and think about the young lady we will talk about, mental health. It's long way, but we can do it. If we South Sudanese accept it, we can do it. We're gonna make it. If SPLA decide to go to Bush, and they took us 21 years, but we got our nation. It's nothing difficult. It's a commitment. So I think to go back all the vision, especially the Red Army, the first Red Army, I think we are in good track to deliver what late John Garang was saying to us. Go educate, come back and help us in this fighting of the development. I know I have a best committed Red Army, so plus the young people, we took it recent when we got our independence. They are a doctor like Ball. They just come from Cuba. And I remember doctor in 2011 or 2010, we were the program, the elimination of malaria with a Cuban doctor. And we moved, but our methods, the war, they stopped that program. It to eliminate what they call malaria itself. We moved all the country that time. But when war started, we didn't go nowhere. And we brought people from Cuba. So the program is related to how to show our people we can fix this country. Like Madinga say, fix South Sudan. But we have to fix the good way. My vision and my group is not just a hospital. We have a lot of problems. And the Minister of Health, all the drugs that come from South Sudan is not justified drugs. No one knows how many drugs they come from Uganda, from Kenya, from Sudan, from Ethiopia. And we don't have credibility that manufacturers. And then we can bring diseases to our people. The issue of the pharmaceutical drug to come to South Sudan is really serious in our nation. So we are building more special a story for drugs, the bigger one, including going to be big in East Africa. And the government of South Sudan, they have to underline a company allow the drug to South Sudan. So we can provide a good service to our citizens. This is the one, I think like 3 months ago, some medicine they brought it and some kids in West Equatoria. I saw in TV and almost I cried. So it's a long way to go, but I'm very sure with the help of the young doctor, we can move in that one. Include this facility. I'm going to sit with the people of Ministry of Health and the police. Some sat around the Mukin is removed fish area, but it needs warnich sanitation. I know it's tough, but we have to save the life of that one. And then when you bring it, the doctor, they cannot receive until they get warnich sanitation, the police. We got discussion to bring the police here with the warnich and we pay and to do this job for us so we can save the life. And I think the minister, they have to help. None of that bigger Ganu. We're going to work very close to Minister of Health. We have a lot of things if we sit together like a citizen of South Sudan and we want to serve our nation, we can do it. Then our will is to serve our people. They suffer long. The facilities is too small. But this is where we started to expand. We're done with our architects. The drawing is finished, including the Minister of Houses with the government of Central Equatoria. These are the land where the capacity to big land, and anyone can see it here. And this is not just for 2 years, 3 years. It can take 20 years. That included the medicine facility, school, and all this one. And include the drawing you will see, that is the bill farm after pass the bill farm. And we're going to start ready. We start bringing people to do this work. But slowly, slowly. But I'm sure they're going to be working. The same, the issue of the mental health, it needs a policy from the Minister of Health. It's a lot of jobs to be done. But I'm very sure if we put our hands together, we can do it. It's nothing difficult in this world. The difficulty was our country, but we are free. Listen, we have a problem, and really it's a problem in our capacity to resolve. We have some doctors, the young doctors, when we're sending outside the scholarship, and we forget about them. And this is the future of the nation. Dr. Madid called me, I was in Nairobi, like 4 months ago. We have 8 doctors, they graduated and become in Cuba more than 1 year. No ticket to travel back. This responsibility is not government alone. It's our responsibility like a citizen. Dr. Madidi struggled with Samata NGO to bring this doctor here. And we have a lot needed for doctors. When we start to take, after independence, before independence, children to medicine in Cuba, where it was given from Cuba government to people of South Sudan, we start from 10. And last year, just 1. So it looks like we don't want to help our people too. We know we go through challenges economically. But we have a lot to be done. The more the thing we can talk until tomorrow. But the reality is how to put ourselves to help our people. I'm going to say thanks again, Ambassador Jada. This week, I think it was Wednesday, he came with a friend from U.S. doctors from Washington, D.C. They come and they see here. And they want teaching hospital, different facilities. And it was say, the background of that doctor, it was a Turkish. They say, we start from like this in Turkey, long time ago. But if the people commit themselves, they can be changed a lot in South Sudan. So, thank you, Ambassador. And like he's saying, we're not going to wait somebody to come to do for us. We have to do ourselves. Ambassador Mende is is a front line for us in China. Leave my general here, the traffic police. I say he was going to come with a uniform today. So, I'm very happy to see the group accept our call to come to tour. But the opener, when we open, we want you, everybody to come. It's no matter this hospital, we're not going to put it like to treat people of the morning. Yes, we're going to get the money, but it's not the principle. The principle how to help people. And the Minister of Health, they have to do a lot of things. They have to go about the law. And we're going to protect our citizens. So I'm very happy and welcome with a lot on the delayed one, but I think public footage maybe can be ready. Some people, they have another appointment, and we cannot keep everybody here. So I conclude my saying, next time we're going to make that. Thank you.
Thank you very much, Bona, Paul, for your concluding remarks. Okay, thank you very much, and please give everybody a big hand for coming today.